Gallbladder pain explained, symptoms, causes and how to treat it naturally. Have you ever felt a sudden, sharp pain in the upper right side of your abdomen, especially after eating a heavy or fatty meal? Maybe it felt like indigestion, but worse. Or maybe it kept coming back and you couldn't figure out why. What if I told you that pain could be your gallbladder crying out for help? This small, pear-shaped organ might be tiny, but when it's upset, trust me, your whole body knows it. From nausea to unbearable pain to even fever, gallbladder problems can sneak up on you fast and turn your daily life into a nightmare. In today's video, we're diving deep into everything you need to know about gallbladder pain, including the most overlooked symptoms, the real causes doctors don't always tell you, and most importantly, powerful natural remedies you can try from home to reduce the pain, support your gallbladder, and potentially avoid surgery. But before we get started, do me, and your health, a quick favor. Hit that like button so more people can see this life-saving information. Subscribe if you want more natural health videos like this one every single week. And don't forget to share this video with someone who's been complaining about abdominal pain, bloating, or gallstones. You might just change their life. Alright, are you ready to finally understand what your body's been trying to tell you? Let's break down gallbladder pain, explained, starting with how this little organ actually works. What is the gallbladder? Let's start from the beginning. What exactly is the gallbladder, and why does it matter so much? The gallbladder is a small, pear-shaped organ located just beneath your liver, on the upper right side of your abdomen. It may only be about 3 to 4 inches long, but its job is hugely important to your digestion. So, what does it do? The gallbladder's primary role is to store and concentrate bile, a yellowish-green fluid produced by your liver. Bile acts like your body's natural degreaser. It helps break down fats in the food you eat so they can be absorbed properly in your intestines. Here's how it works. Every time you eat, especially something fatty like fried chicken or creamy pasta, your gallbladder gets a signal. It squeezes and releases bile through a duct that connects to your small intestine. This process helps your body digest fat smoothly and efficiently. But here's where things can go wrong. When bile becomes too thick or builds up cholesterol, it can lead to blockages, inflammation, or the formation of gallstones, small, hardened clumps that can cause serious pain and digestion problems. If the bile flow gets blocked, your gallbladder gets irritated, inflamed, or infected. That's when gallbladder pain starts to rear its ugly head. And let me tell you, it's not something you want to experience more than once. An inflamed gallbladder, also called cholecystitis, can turn your calm digestive routine into a painful emergency. And in some cases, people don't even know their gallbladder is struggling until it's too late. But here's the silver lining. By understanding how the gallbladder works and the early signs of trouble, you can take steps, right now, to protect it naturally. To recap, the gallbladder stores and concentrates bile. Bile breaks down fats in your digestive system. Without proper bile flow, digestion becomes difficult and painful. And if bile gets thick or stagnant, gallstones and inflammation can follow. So now that you understand this powerful little organ and what it does, you're ready to recognize the symptoms when things start going wrong. Coming up next, we'll cover the most common signs of gallbladder trouble, including the silent symptoms most people miss. If you've ever had strange digestive issues after eating or unexplained pain in your side, you won't want to miss it. Common symptoms of gallbladder pain. Now that you know what the gallbladder does, let's talk about what happens when it starts to struggle. The signs of gallbladder trouble can be sneaky at first, then suddenly become impossible to ignore. Let's break down the most common, uncommon, and dangerous symptoms of gallbladder problems. Pay close attention, some of these may surprise you. 1. Sharp pain in the upper right abdomen. This is the number one symptom. If your gallbladder is inflamed or if gallstones are blocking bile flow, you may feel a sharp, cramping, or stabbing pain just under your ribs on the right side. It might feel like a knife twisting in your side, often after eating, especially something greasy or high in fat. This is called a gallbladder attack or biliary colic. And guess what? It can last anywhere from 15 minutes to several hours. 2. Nausea and vomiting. Many people with gallbladder issues report feeling nauseated, sick to their stomach, or actually vomiting, especially after meals. If you frequently feel queasy after eating fatty foods, your gallbladder may be the hidden culprit. 3. Bloating, burping, and gas. Sound familiar? These are digestive red flags. When bile isn't flowing properly, your digestion slows down, causing excessive gas, burping, and uncomfortable bloating. You might blame it on what you ate, but the root cause could be a sluggish or inflamed gallbladder. 4. Pain between shoulder blades or in the right shoulder. This is one of the most overlooked symptoms. You might not think shoulder pain has anything to do with your digestion, but in fact, the nerves connected to your gallbladder can refer pain to your back or shoulder. Especially the right shoulder blade. It's called referred pain, and it's your body's way of sounding the alarm, even if the source isn't obvious. 5. Changes in stool or urine color. When bile isn't flowing properly, your waste reflects it. You might notice pale, clay-colored stools or dark, tea-colored urine. That's a sign your body isn't eliminating bile the way it should. This is often an early symptom of a blocked bile duct, and if left untreated, it can turn serious quickly. 6. Yellowing of the skin or eyes, jaundice. Jaundice is a major warning sign. When a gallstone blocks the bile duct, bile builds up in your bloodstream. This can cause your skin and the whites of your eyes to take on a yellowish color. If you ever see this, don't wait. It could signal a life-threatening blockage or infection. 7. Fever and chills. Pain and digestive problems are one thing. But when you start experiencing fever, chills, or sweating with your gallbladder pain, it's a red flag for a possible infection or inflammation, also known as acute cholecystitis. This isn't something you want to treat at home. Infections of the gallbladder can become dangerous and even lead to sepsis if left untreated. 8. Fatty food intolerance. Ever eat something fatty and feel awful afterward, bloated, nauseous, crampy, or gassy? That's a classic gallbladder distress signal. When bile isn't flowing right, your body struggles to digest fat. Over time, this becomes a consistent pattern. People often say, "I can't handle greasy food anymore." That's not just aging, it's your gallbladder asking for help. 9. Silent gallstones, no symptoms at all. Here's the tricky part. Many people have gallstones and don't even know it. These are called silent gallstones. They may not cause symptoms, until one day, they shift and block a duct, triggering a painful emergency. This is why knowing the symptoms and staying aware is so important, even if you feel fine today. Let's quickly recap the 9 major symptoms of gallbladder trouble. Sharp pain in the upper right abdomen. Nausea and vomiting. Bloating, burping, and gas. Pain between the shoulder blades. Pale stools or dark urine. Jaundice, yellowing skin or eyes. Fever and chills. Inability to tolerate fatty foods. No symptoms at all, silent gallstones. If you've experienced 2 or more of these symptoms regularly, it's time to start paying close attention. These aren't random. Your body is speaking, and your gallbladder may be the one calling out. In the next section, we'll reveal what actually causes gallbladder problems, and how your daily habits, hormones, and even your weight could be working against you without you realizing it. Causes of gallbladder issues. Now that you know the warning signs, let's dig deeper into the real causes of gallbladder problems. Why do some people get gallstones or inflammation, while others don't? There isn't just one reason. In fact, several hidden factors can damage or disrupt your gallbladder over time, often without you noticing. 1. Poor diet, high fat, low fiber. The number one culprit. Poor eating habits. Diets high in unhealthy fats, processed food, and sugar, but low in fiber, increase your risk of gallstones dramatically. When you eat fatty junk food often, your liver produces more cholesterol. This cholesterol enters the bile, which becomes thick and sludgy over time. And thick bile leads to gallstone formation. 2. Rapid weight loss or fasting. You might think losing weight fast is healthy, but when it happens too quickly, your liver dumps extra cholesterol into the bile. That overload can trigger gallstone formation, especially during crash diets or long fasting periods. This is especially common after weight loss surgeries like gastric bypass. So even if you're trying to eat healthier, doing it too quickly can backfire. 3. Hormonal imbalances, especially in women. Did you know that women are twice as likely to have gallbladder issues as men? Why? It has a lot to do with estrogen. This hormone increases cholesterol in the bile and decreases gallbladder movement. That's why women who are pregnant, on birth control, or undergoing hormone therapy are at higher risk. Even menopausal hormone changes can slow bile flow and contribute to gallstone development. 4. Obesity and sedentary lifestyle. Being overweight, especially with fat concentrated around the belly, puts extra pressure on your digestive system. It also increases the amount of cholesterol your liver produces, which thickens bile. Plus, being inactive slows down the natural movement of your gallbladder. When bile sits still too long, it clumps and hardens. This is known as bile stasis. 5. Diabetes and insulin resistance. People with diabetes or metabolic syndrome are more likely to develop gallstones, because insulin resistance affects how your liver processes fat. It causes more cholesterol to be dumped into bile, and slows gallbladder contractions. That double whammy increases your risk of stones and inflammation. 6. Family history and genetics. Some people are just more prone to gallbladder issues because of their genes. If your parents or siblings have had gallstones or gallbladder removal, your risk is higher. Your body might naturally produce thicker bile, or your gallbladder might not empty as efficiently. This is why staying aware of symptoms is key, even if you feel healthy today. 7. Age and gender. Gallbladder problems tend to become more common after age 40, and especially in women. In fact, doctors often say the classic gallstone patient is female, 40, fertile, and fat. Crude. Yes. But it highlights the key risk factors. Age slows everything down, including bile movement. Combine that with other risk factors, and the gallbladder becomes more vulnerable. So, let's quickly recap the most common causes of gallbladder problems. Diets high in fat and low in fiber. Rapid weight loss or fasting. Hormonal changes, especially in women. Obesity and lack of physical activity. Diabetes and insulin resistance. Family history or genetics. Age and gender factors. If you can spot these risk factors in your own life, it's time to take action. The good news. You don't have to wait for pain to start before making changes. Coming up next, we'll explore the natural ways to support your gallbladder, including what foods to eat, what to avoid, and how to stop stones before they start. Natural remedies and treatments for gallbladder pain. Now that you know the symptoms and causes of gallbladder problems, you might be asking, what can I do about it, naturally? Good news, there are safe, effective, and natural ways to support your gallbladder, reduce pain, and even prevent gallstones without drugs or surgery. Let's go step by step through the top 7 natural remedies and treatments that truly make a difference. 1. Adopt a gallbladder-friendly diet. Food is medicine, and for your gallbladder, it all starts with a low-fat, high-fiber diet. Focus on leafy greens like spinach and kale. Fruits high in vitamin C, like berries and citrus. Whole grains like brown rice and oats. Lean proteins like fish, beans, and legumes. Healthy fats from avocados, nuts, and olive oil in moderation. These foods keep bile flowing smoothly and reduce inflammation. They also help prevent gallstones from forming. 2. Avoid gallbladder triggers. Want to stop gallbladder pain before it starts? Avoid the common dietary villains. Fried and greasy foods. High-fat dairy, like cheese, cream, butter. Processed foods with additives and sugar. Refined carbs like white bread and pastries. Carbonated beverages and artificial sweeteners. These foods thicken bile, trigger gallbladder spasms, and increase your risk of stone formation. 3. Drink warm lemon water in the morning. This simple ritual can do wonders for bile flow. Squeeze half a lemon into warm water and drink it first thing in the morning. It helps stimulate your liver and gallbladder, thin out bile, and support digestion throughout the day. Add a pinch of turmeric or ginger for extra anti-inflammatory power. 4. Use herbal remedies wisely. Nature offers powerful herbs that can soothe gallbladder discomfort and support liver detox. Top picks include milk thistle, boosts bile production and liver repair. Dandelion root, stimulates bile flow and digestion. Peppermint oil, relaxes gallbladder muscles and eases pain. Turmeric, reduces inflammation and helps break down gallstones. Always speak with your doctor or herbalist before starting any new supplement, especially if you're on medications. 5. Maintain a healthy weight, gently. Losing weight too fast can cause gallstones. Instead, aim for gradual, sustainable weight loss through diet and movement. Try brisk walking for 30 minutes a day. Focus on core strengthening and flexibility. Practice gentle fasting only under supervision. Even a small drop in weight can improve gallbladder function and reduce inflammation. 6. Stay hydrated, but sip smart. Bile is mostly water, so staying hydrated helps keep it thin and flowing. Dehydration leads to sludge-like bile, which hardens into stones. Drink 8 to 10 glasses of water a day, but avoid gulping large amounts during meals, which can dilute stomach acid. 7. Apple cider vinegar soother. A time-tested home remedy. 1 tablespoon of apple cider vinegar in a glass of warm water. Drink it before meals to boost bile flow and digestion, or during a mild gallbladder flare-up to soothe pain. Bonus: ACV may help dissolve small cholesterol-based gallstones over time. Always consult a healthcare provider before attempting any flush, especially if you've had gallbladder attacks or confirmed stones. Let's recap the 7 best natural ways to treat gallbladder pain. Eat a gallbladder-friendly, anti-inflammatory diet. Avoid fried, fatty, and processed trigger foods. Start your day with warm lemon water. Use herbal remedies like milk thistle and peppermint. Lose weight slowly and stay active. Stay hydrated, sip water throughout the day. Try apple cider vinegar to improve bile flow. These remedies can make a big difference, but remember, consistency is key. If your symptoms are persistent or severe, don't ignore them. Early action could save your gallbladder and your health. Coming up next, we'll explain when it's time to seek medical help, and how to avoid gallbladder removal if you catch the signs early enough. When to see a doctor and how to prevent gallbladder surgery. You've learned how to manage gallbladder issues naturally, but what happens when symptoms don't go away? When should you stop treating it at home and seek help? Let's talk about the red flags you should never ignore, and what steps to take to avoid gallbladder removal surgery. 1. Watch for severe or frequent pain. If you experience sharp, sudden pain in the upper right abdomen, especially after eating, that lasts more than 5 hours, it could be a gallbladder attack. This pain may radiate to your back or right shoulder. If it's frequent or growing worse, don't wait. That's your gallbladder crying out for help. 2. Fever, chills, or nausea, warning of infection. Gallbladder inflammation, or cholecystitis, can become dangerous if not treated quickly. Watch for ongoing fever or chills, nausea or vomiting that doesn't improve, abdominal tenderness when touched. These are signs of a potential infection or blockage, which can become life-threatening without treatment. 3. Yellowing skin or eyes, jaundice. Yellowing of the skin or whites of the eyes, called jaundice, may signal a bile duct obstruction. That means a gallstone has gotten stuck, preventing bile from flowing. This is a medical emergency. If you notice this symptom, go to the hospital immediately. 4. Can gallbladder be saved without surgery? In many mild or moderate cases, yes, you can avoid gallbladder surgery if you act early. Thousands of people have reversed inflammation and passed small stones through diet, herbs, hydration, and weight management. But if stones are large or attacks frequent, your doctor may recommend surgery to prevent complications like infections or pancreatitis. 5. If you do need surgery, what happens? The good news. Most gallbladder surgeries today are minimally invasive. Called laparoscopic cholecystectomy, this surgery uses small incisions and usually lets you go home the same day or the next. Many people live normal lives without a gallbladder. But without it, digestion, especially of fats, can be harder. So long-term lifestyle changes will still matter. 6. How to prevent gallbladder surgery naturally. If your symptoms are still mild, or if you want to protect your gallbladder for life, here are 4 things you must start doing now. Clean up your diet, remove fried and fatty foods. Support bile flow, with lemon water, ACV, and herbs. Keep moving, daily activity helps keep bile moving. Stay hydrated, thin bile equals less risk of blockage. Simple changes, done consistently, can mean the difference between freedom and surgery. So, whether you've just started feeling symptoms, or you're managing gallbladder pain already, remember. You have power. You have options. And it's never too late to heal, or prevent surgery, when you make the right choices today. If you found this video helpful, don't forget to like, subscribe, and share it with your friends or family who might be experiencing gallbladder issues. Comment below with your experience. Have you had gallbladder pain? What worked for you? And remember, your health is in your hands. Stay informed, stay empowered, and stay healthy.